Hi,
Hi,
Dr.
Joseph.
Parekh.
How are you?
I'm well. How are you?
Good. My apologies for the delay.
No worries at all. I am just
Okay.
glad you've been able to come out and take some time out in this hectic and this madness that's currently uh,
Yes.
going on, isn't it?
This being the right word. Yes.
Yes, it is. So, a quick. I won't really waste your time, Doc. But Dr. Nihar Parekh, one of Mumbai's top pediatricians, also the director of Cheers. Have I got that wrong? Cheers Childcare. I've got it wrong, right? Cheers Childcare, Mumbai, and somebody who's got this way about bringing the message forward, which is exactly what we need today. Without the panic, without the palpitations, just let's listen in, let's ask our questions, and get some clarity. So, Doc, I heard you mentioning in one of your videos recently that the infections are plateauing. Is that really true?
Yes, they are. Because what we've also realized over time is the number of cases that are suddenly shot up after the end of the second wave, and once we got into the third wave, was purely because of the contagiousness and the ability of this virus to spread so fast. And beyond a certain limit, there was no lockdowns that was going to help. This virus was airborne. It was entering every home. We were traveling
Yeah.
back and forth. There were family functions still happening. And because of the pure contagiousness of this virus, I think there was not much we could have done at any point to keep this virus at par or at bay. So it has entered, and most of them are infected and recovering well. So the numbers are plateauing now. I don't see any future spike now. The plateau may extend itself for a week or two, maybe even a month. But another crazy spike like this, I think we've run out of spikes. There's no possible way it can spike more than this.
Well, I'd love to hold on to that, but amongst all this, is there anything that is currently worrying you, though?
No, my worry is the sheer number of positive cases. What it does is when the virus enters the child's body, it does compromise the immunity of the child.
Yeah.
And although this virus is not damage causing at all, and I would take that liberty with that confidence to say that it's only 10% as pathogenic as the Delta. So the damage done is 90% less than what was seen in the second wave. Its ability to drop the immunity temporarily in children is a lot. My fear is that it's infecting kids less than even 6 months of age. Our youngest patient was 45 days old. And the child recovered very well. But at that point, any which ways, a child is having a very low immunity. So the chances of a virus dropping the immunity in a very small child or dropping the immunity in a normal toddler or a teenager is high. And then what happens is the chances of secondary bacterial infection. Secondary infections in form of prolonged coughs and pneumonias. We've seen a lot of stomach infections come after a week of the COVID. We've seen few girls with appendicitis come up secondary to COVID. So there are a lot of short-term secondary infections which are being seen purely because of this virus's potential to drop immunity temporarily. So this is just a piece of advice and a sense of request that once your child recovers, which he or she will very quickly, don't be in a hurry to go out and celebrate. Don't be in a hurry to order outside food. Don't be in a hurry to travel, or don't be in a hurry to meet people in abundance, because the child still has the potential to catch a second infection very quickly, because it takes at least 3 to 4 weeks for the child to completely recover immunity wise after this COVID. Otherwise, if you ask me from the virus point of view, I'm not worried so far, not at all.
Good to hear that. And my apologies that your screen is completely blocked with all the questions we're getting inundated with. And I will come to those questions, people, so bear with me. But I just want to go through some basics with the doc first. The other crucial issue that's bothering a lot of parents is about schools opening, and I think it's about time that schools open is what parents like us say, but there's trepidation as well, right? What would you say?
I say your kids should have been sent to school yesterday. That's what I would say. Do not even waste one day. Please send your children to school. We've seen another pandemic of emotional and behavioral issues over the last 6 to 10 months more so, between the second and the third. Adolescent children are trouble, teenagers are trouble, young toddlers are getting aggressive, temper tantrums are hitting the roof. The harmonious balance in every household is sort of at a very at the edge, on thin ice. Everyone is requiring their own space, which is making it very difficult to coexist now. And more so, putting all these things on the side, a child's growth is always a global growth. We are, as humans, are social animals. Our children require to meet other children. Our children learn in a proper disciplined learning environment by touch, feel, exposure, share, care, emotions, breathing fresh air, running in the playground. Structured approach to education is the only way forward. Screen has its limitation. I mean, it's played a great role when we needed it the most, but now it's about time we put it at the back burner and send our kids to school.
So, given that only 15 to 18 age group is getting vaccinated, and the age group below is still kind of exposed, what is the message that you would send, not the children, to the parents? When you send the children out there, what is it that we can do? Because I've seen, my children have had, I'm in the UAE, so my children have had bouts of going to school. And Doc, I can tell you that, it's done wonderfully for them. But on the other hand, I do know that the masks, you send them with a mask, but, what happens in school, right? And it stays in school.
Absolutely, absolutely. We may hear about it from the teachers, but never from our kids.
Right.
So this is what I would say. If you're been in Mumbai, at least where I practice, over the last 3 months, and if you're over the last 3 to 4 weeks to be precise, and if your kid has been through cough, cold, fever, or your pediatrician has told you that there is a possibility of COVID, I would say your child has already got the shot. I would say this actual Omicron infection is working like the long craved vaccine that we wanted in our children. It gives them sickness for a few days, but it gives them that shot of immunity because the antibodies start hitting sky high from the 7 to 10 day onwards. And at least for the next 3 to 4 months, your kids have nothing to worry. Now, mind you, when you send your children to school, and if they've not been through the Omicron already, they will catch the virus because this virus is extremely contagious. You may have to take a leave for 7 days. Your child will get 2 days of fever, maybe cough, cold for a few days. But in 7 days, your kid will be back to normal. So let the people realize, let the parents realize that if your kid has been through the query COVID or Omicron phase in the last 3 weeks, you're good to send your kids to school. Number two, if your kid has not gotten it, and if you send your kid to school, there is a high possibility he or she will get it. And if that happens, please don't hold the school's throat and wring them by their neck because it's not their fault. Like you rightly said, when you send your children to school, wearing masks has its limitations, social distancing has its limitations, but that is no reason for us not to send our children to school. Let's start living with the virus. Let's try and put our panics away, fears away. Let's resume our day-to-day lives, our kids' day-to-day lives. Let's give our kids the lives that we promised them without that fear and panic and insecurity of them falling very sick so as to reach the hospital. Every school does its best to have their fully vaccinated staff, to try and keep their social distancing. They're doing their best, and I'm sure they will. But if and when you send your children to school, be mentally prepared that some of them will catch it, but they all will recover in 7-10 days, and they will be full of antibodies to get them next 3 to 6 months.
Yes, I think we all have to just bite the bullet and send them back because I think they're a mess right now. But I'm going back to another issue that was bothering me from one of your video reports, Doc. That was about the opportunistic infections that you've been speaking about, and I think that needs to come out a little bit more. I think the question is, how much what is it that we will expect once COVID, when a child is recovered? One is, the kind of stuff that we can expect that is normal and we shouldn't panic once the child is recovered. And what is it that are the red flags that we should be looking out for once the child is recovered?
Jyotsna, it's a very simple red flag. I would tell every parent that when your child goes to fever for the first 2 days, and there is a high suspicion of Omicron either by the pediatrician or there's someone in the family who's detected positive, we take it as Omicron. We expect 1 day of very bad fever, a better second day, and even a better third day. The lingering effects of 99s and 98.5s can stay for a week. The repercussions post-COVID of persistent cough, tummy aches, slight on and off nausea, loss of appetite, lethargy, body aches can stay for another 4 to 5 days. Now, after the second day of fever is gone, and your child has 48 hours of no fever, that is by definition, fever less than 100. And then within the next 5 to 7 days, if suddenly you see a resurgence, a respike of fever crossing 100, 100.5, that's your red flag. That's the time when the opportunistic infection may have occurred, which requires an urgent testing. Or if your child shows sudden deterioration of health, means he or she has been through first 2-3 days of fever, is recovering well, but on the 6th and 7th day, suddenly you see the cough increasing more than what it used to be. Sudden onset loose motions, vomiting, sudden onset unbearable pain in the stomach, or just as a gut feel of a mother that, look, he was doing well, I'm not happy with her today. There's something that's gone on. Trust your instincts. Mother's instincts are usually 100% correct. Go to your pediatrician, get your child checked out. So 2 red flags: resurgence of fever and worsening of symptoms, sudden onset worsening of symptoms is a red flag for you to go back to your pediatrician and say, look, we need to get some tests done.
So a question here, can the child still be positive even if the report says negative?
So once a report is positive, that is either an RT-PCR or a rapid antigen, your child is positive. The child will show symptoms, go through the array of disease for 7 to 10 days. We do not need a repeat test to check whether the child is out of the virus or no. If a test is positive and you repeat the test in 2 days and it comes negative, it still means that your child is positive. Once positive is positive, period. A repeat test that shows negative doesn't mean anything. But I also like to pass the message on that you do not need to retest to check whether the virus has left the body, because the positive test can stay positive up to a month or 2 with the dead virus particles. It doesn't mean your child still has the disease. It doesn't mean that the child is still contagious. Once 7 days are over from the start of the first symptom, your child is done with the disease, your child is not contagious, you can resume normal activities, period.
So here's another question with that. I hope you're okay that I'm asking these questions intermittently, Doc, because these are all your fans and followers. My child has had all the symptoms of Omicron 2 weeks ago, recovered completely, but has been complaining of headache for the last 2 days. Should the person be worried?
Yes, lingering headaches are known for up to a month. Oh. Just regular steam, open up the sinuses, do all your home remedies, don't over-medicate. Maybe the paracetamol if the pain gets unbearable. Give him some time, give her some time. It's a part of the recovery process. I would not be alarmed.
So there's another thing, there's a lot of, I don't know whether those are rumors or scaremongering that, there's a lot of Delta in the mix as well with Omicron. And our genome sequencing is taken another fluttering shot back with, I think, 4 labs just shut down today. So, how does that impact the kind of treatment you give children?
Even in the peak of the Delta, the scary wave, we had symptomatic treatment, but the kids were much sicker. We had a lot of complicated, because the Delta was a very notorious and a scary virus. It had the ability to put a 40-year-old on a ventilator. In children, it didn't spare the children either. We had a lot of kids who had even required blood thinners and were admitted, and we were monitoring the vitals, and we were a little worried at that time. But in the last 3 months, with the ending second wave and the lull in the second and the emergence of the third Omicron wave, we've had 0 short-term or long-term worrying consequences with the Omicron virus. I'm not worried about the virus causing any substantial harm, short-term or long-term. And your question about whether Delta is still in the mix, I would say less than 3%. I mean, it's been globally, especially in India, we are very confident because the symptomatology is very different between the two. Not the presenting symptoms, but how it behaves through the first 5 to 7 days is very different. Delta was a painful virus. 7 days of fever, 5 days of, vomiting. Children were very sick. The Omicron children are not sick. And we 99, I would say, I would take that leap of faith and say that all kids that I've seen in the last 2 months have been Omicron. And it's a global proven fact that Omicron has officially taken the pedestal of being the dominant variant in our country, in our city, being 95% of the cases. So I would not worry about Delta as, when it comes to your children, our children.
And once you've recovered, once a child has recovered, how long does the child have to wait to get the vaccination?
15 days. I don't think you need to wait for those 3 months and 4 months. I think once your child is out, so 15 days is good enough to take, because here in India, we are vaccinating children above 15 to 18. So every child who's been through that age group with Omicron, once they recover, taken their 7 days of rest post-recovery, please go take your shot.
Fair enough. And here's a question. Here's a question that will ask you to become a forecaster as well. So when will we be free from COVID? Do you have any answers, Doc?
Like I would reiterate my sentence, which I spoke 10 minutes ago. We have to learn to live with the virus. Now, if by definition of free, you mean the virus ceasing to exist, that's not going to happen. It's like wishing the flu virus didn't exist. But it will have the capacity to do as much damage as the flu virus. So we learn to live with it. If you're talking about social isolation and restrictions, I think another 6-8 months, once we have back-to-back the 4th and the 5th wave, which is much milder than the Omicron, and we know that it does almost near zero harm, then I think the masks will also be but I don't see that happening in 22. I think 23 Jan would be my forecast, being mask free. But we have to learn to live with the virus. We can't restrict schools, we can't restrict playgrounds, we can't restrict extracurricular activities when it comes to children. Please resume your day-to-day activities.
Can children get reinfected? And if they can, what is the kind of, the duration that is safe that they will not be?
With the Delta, which was a very serious virus, I could very confidently say 6 to 9 months was good enough, because the antibody product, it's a very simple physiological phenomena. Stronger the disease, stronger the antibody response, and longer the antibody response. Omicron is a milder wave, so milder disease, milder is going to be the antibody response, which I see at least giving you 3 to 4 months. But I also hope and pray within the next 3 to 4 months, all kids of all age groups will get their shots.
Oh, that's excellent. That's really good to hear. For medication, what is it that what is the first line of medication that you're telling your patients here? Somebody's asking about Calpol as well, but what is your,
Let me start by giving a little take-home message. Even though, a lot of parents have this habit of testing their children unnecessarily. First advice, do not test your child if your child has no symptoms. Number 2, do not medicate your child if your child has no symptoms. Number 3, even though your child is positive and has no symptoms, do not medicate. And number 4, if your child has symptoms and is positive, only treat the symptoms. 99% of the fevers, respond to simple medicines. Yes, first day is not easy for paracetamol to do its job. We sometimes take help of ibuprofen, but by the second day, they start responding to the paracetamols. Even ibuprofens are not required. And by the third day, the fever wavers off. And then, all parents are masters at symptomatic medicine, cough syrup as and when required, decongestant, antacids, probiotics. Some people are anti-medicine, so do home remedies. We are all for everything that makes the parent comfortable, because at the bottom of our hearts, we know that now nothing can go wrong.
Are we underestimating weakness, both in adults and children?
Sorry, I didn't get your question. Underestimating?
Weakness as a result of...
Yes, we are, because we are expecting children to bounce back in 2 to 3 days, which is not correct. It takes a 7 to 10 day toll on the child's body. Younger children can't express themselves, so they're cranky, they're clingy, they're aggressive and irritable. I've seen teenagers sleep for days after the COVID. They're just recovering. And kids who are taught between 5 and 7 years of age have complete loss of appetite and have no energy. So I don't want every parent to underestimate their child's potential to kind of recuperate on their own and not pump them with unnecessary multivitamins. Don't expect your child to eat a normal diet when your child is recovering. You can't expect the child to have the regular diet. So you have to be very patient. Your job as a parent is just to offer plenty of liquids orally, semi-solids diet, small quantity meals at small intervals, not to push and shove things down their mouth when they can't swallow. You'll only make them vomit and make the situation worse with dehydration.
Have you come across any patients with loss of taste and smell this time around, Doc?
Very, very less. Very less. But all viruses have a potential to cause loss of sense of taste and smell. Even before the COVID, we had flu. But before that, we were never so aware as to express that symptom so confidently because we didn't know that it would be such a problem. So even during a regular flu, let's say 2 years ago, and you were down, your nose is so blunted that you don't smell anything. And you could tell a lot of kids used to have loss of taste and, they were aversive to eating well. And that's the reason. But I don't think I would take that symptom that strongly anymore, especially in the Omicron wave.
So can kids exercise after COVID or play sport, or what is the kind of duration that you recommend children should rest it out?
So 7 days is the period, 7 to 10 days is the period of the virus. Next 7 to 10 days, let them do 50% of the regular exercise. And after 15 days, let them do what they want.
Fair enough. I think someone's asking, is there more scope of waves? But I think Doc has already answered that we have to learn to live with the virus. What is the most common symptom that you're seeing?
High spiking fever with very bad throats, headaches, and severe body aches. Obviously, children of different age are able to express it differently. In younger children, they only are super cranky and they only have high spiking fevers. And we need to clinically examine them to have a high suspicion. But as of now, Josna, any child with high fever, if we all should have a very high suspicion for COVID.
And how long do you expect post-Omicron loss of appetite to last?
7 to 10 days. I would request every parent to again be patient. Don't worry as long as your child is not dehydrated. And the first sign of dehydration is not being able to pass urine as frequently as every 5 to 6 hours. So if you see the gap in the urination increasing, that's another red flag.
I have a very basic question for you, Doc. The kind of masks that children should be using, I'm still seeing adults with the cotton masks and everybody's talking about the KN95s or whatever. Can you clarify this for all of us?
So Omicron cannot be prevented with a cloth mask. Omicron cannot be prevented by a surgical mask. A doubling up of a cloth and a surgical mask is known to help, but not as much as an N95. It is shown that if both the people are wearing N95, the chance of them to transmit the disease to one another is less than 1%. So N95 is the order of the day. A child less than 2-year-old should not be masked. Between 2 and 5 should be given a well-fitted 2-ply or 3-ply cloth mask. Above 5 to 6 years, you have pediatric N95s. Above 8 years is an adult N95 mask.
Brilliant. Thanks for the clarity there. Post remedy for kids who've been infected, especially respiratory system.
Yeah, so, we've seen, that's a good question. We've seen the only prolonged symptom, which is the commonest, is a very bad hacking, long-standing cough, which is kind of involving the upper respiratory tract, and in children lesser than 2 years is known as a croup, what we call as a laryngotracheobronchitis. It's not your typical lung involvement, what we saw in Delta wave, causing the loss of oxygen supply and drop in saturation and requirement for intensive care and ventilation. It's just the upper respiratory tract going a little down. So these coughs sometimes require cough syrups prolonged. Some of them require nebulization. Some of them even require a short-term inhaler therapy, but that's pretty much it. But coughs are known to linger. I would not worry too much.
As is phlegm, is it? I'm seeing that in adults as well, right?
Correct. Because that's the productive phlegm you're trying to kind of spit out. And, it gets worse when you lie down and you feel like there's something constricting in the chest. It's your basic spasm and congestion in the windpipes.
And any multivitamins that you suggest?
Our parents are big fans of multivitamins, and questions like, what can I give to prevent COVID? I think there is no medicine in the world that can prevent COVID except an N95 mask. But yes, there are 2 vitamins have known to play a good role in post-COVID recovery phase, which is zinc, any multivitamin that contains zinc, and vitamin D, which is the magic hormone, helps in recovery from everything. Again, these are prescription medications, so please don't self-medicate your children. They also weight-based dosage systems, so it's not the same dosage for every child, it's as per the weight. So talk to your pediatrician.
What about asymptomatic cases? There's a lot of confusion as to how, families are to go about handling their children when they're asymptomatic. Who is to quarantine? Whether you're to quarantine, can you go out? Do you need to keep testing? What is the protocol for this?
So an asymptomatic positive child, I would not test the child if the child is not symptomatic. But for any reason that, you want to do it because everyone else is positive in the house, or if you just traveled, an asymptomatic child technically needs isolation only for 3 to 4 days, just for the purpose of monitoring whether the symptoms are coming up later. The chances of an asymptomatic positive child to cross-infect anybody else is very, very less. Because it's simple physics. If the child is not having symptoms of cough and cold, they don't throw the virus into the air. And since then the virus can't be airborne and infect anybody else. The chances are there to touch and fomites, but those are less than 5 to 7%. So I would not go down into that carrier stage. I would not go down into asymptomatic positives. But if your child, for any apparent reason, has tested positive and does not have symptoms, monitor the child closely for 3 to 5 days and see if he or she develops symptoms. If he or she doesn't develop symptoms, then pretend that the child doesn't have the disease.
And at what stage do antibiotics come in? So, there's the acitral and the augmentin that are doing the rounds very anecdotally.
Yes. So, secondary bacterial infections, what we spoke about, opportunistic infections, is the primary number one role of antibiotics. That's when the red flag and like we spoke, that the fever resurges and it's documented bacterial infection. If you ask me directly, is any antibiotic played a direct role in helping the child recover faster? I would say no. It is only symptomatic medicines. But you know what? It's a real world that we live in. No, we don't following the books as per protocols is one aspect of practicing pediatrics, but handling panic parents is another aspect of pediatrics. So you talk to every parent. Every patient should be treated differently. The approach has to be different. We don't follow very strict protocols in children. If the family is on board, is patient, we don't need anything besides simple fever medicines and symptomatic meds. If the parents are very much in a panic state, they are insisting and you know that they're going to start an antibiotic irrespective, you rather give them a little azithral to calm them down, but with a simple standing instruction that your child does not need it and we are writing it just as a backup. But no, not a big fan of antibiotics, at least in the first 2 to 3 days.
What is the average length of the infection that you're seeing right now?
2 to 3 days of fever and 7 to 10 days of, 90% get okay by the 7th day. Of the other weaknesses, stomach ache, body ache, maximum 10 days, not longer than that.
If an 8-month-old baby has COVID, what is the emergency tipping point to take the child to the hospital?
Fever lasting for more than 48 hours, or if within the first 48 hours, if the 8-month-old is showing other signs and symptoms in the form of lethargy, refusal to feed, decreased urine output, not responding to your voice, and lastly, persistent vomiting, even in the first 24 to 48 hours, is a good enough sign to take him to the hospital straight up.
And here's a rather different question. C-section, 20 days after C-section, if you get bad fever, what do you do?
I would still keep a high suspicion for COVID. From the point of the child or from the point of the mother?
I don't have a clarification. Please clarify, DJ. I'm presuming it's the mother, actually. Maybe.
Yeah.
But
so that it will still not bother her. She can continue to breastfeed if that's a primary question.
I guess.
With a mask on, and it's a good way. You will be passing antibodies passively to your child through your breast milk.
So, before I just let you go, what are the symptoms that we shouldn't really be worried about, if the fever is, say, till this point? I know you mentioned that, but, just to clarify one time so that there's no panic in the houses for like a certain amount of days and, no one is tipping and tripping.
I'll prepare every parent that be mentally prepared that the first 24 hours, your child is going to go through a relentless bout of fever. He will not respond to standard protocols of paracetamol. You may require to sponge the child. You may require help of an ibuprofen. You may see frequencies as short as 3 hour gaps. You may see fevers not even touching the baseline and staying constantly above 100. But I guarantee you the second day will be a much better day and the third day is going to disappear. Now, if the same pattern of relentless fever in the first 24 hours continues even through 48 hours, then that's your red flag to go to the hospital.
This is something that I've noticed in adults, at least, that a lot of they have all the symptoms, but the reports are coming negative. Is that something that you're seeing in children as well?
Yes, absolutely. The Omicron has found a way to escape the standard RT-PCRs and RATs, rapid antigen tests. So we tell every parent if both the tests are positive, if either of the tests are positive, it is positive. But even if they are negative, even the RT-PCR, which was considered the gold standard in the Delta, the Omicron is finding a way to escape that. So it's more about clinical suspicion, your pediatrician taking charge of seeing the symptoms, what they look like, family history of travel, of anyone sick in the house. It all boils down to that. But Josna, again, I reinstate the fact that for the next 15-20 days, if anyone has a sore throat, body ache, and high fever, take it as Omicron unless until proved otherwise.
Fair enough. And do you recommend saline nasal sprays every day in the morning before the children are sent to school?
As a prevention, no. Where you put them through so much trouble, they don't like that.
So basically, body aches, dry coughs, coughs that are persistent, stomach issues. I think these are the big, I can keep going on with the questions for you.
Yeah, fever has to be a predominant symptom to have a high suspicion. Fever.
And here's another question that a lot of adults have also asked in one of my sessions. Is this a blessing in disguise if babies get COVID in this wave as the symptoms are much milder and fertility is next to zero?
Absolutely the best way ever. I think for the first time, we have outsmarted the Omicron virus or the COVID virus. So this is the best natural form of immunity building, is the best natural vaccine that God has given us in this form of a wave. And this is the beginning of the end of the virus. This is what I feel. This is the big fat halogen light at the end of the tunnel. This is what I feel.
Okay, last question. I'm sorry, people, I won't be able to take anymore because I have to let the doc go. When you're asymptomatic, when a child is asymptomatic but has, has tested positive, what about the immunity, the antibodies, all of that? How does that come into play?
So if your child is asymptomatic positive, like I said, Josna, the milder the disease, the lesser is the antibody response. And if your child is just having the virus sitting here and causing no disease, is less likely that your child will have any antibody response or so minor that is taken as negligible. So your child has to go through that 2 to 3 day disease to have a good antibody response.
Do you have any cough medicine that you can suggest for teenage children?
All cough medicines are very different for different kinds of cough. So depending which part of the airway has been involved, let the doctor take care of that.
And is diabetes an after effect of Omicron?
No, this is some rumor. It's not, we've not seen we are on platforms across pediatricians internationally, nationally, locally. It's not that what we've seen. I think there is some miscommunication somewhere. One or off case because so many kids are getting it. You will hear, but nothing significant, nothing worrisome, nothing worthwhile.
Does the flu shot help against, if there are cases of pneumonia as a result of COVID?
So, flu shot does make your child's lungs much stronger. It prevents opportunistic infection later. It does not protect against the Omicron. But the Omicron per se is not known to cause a lot of lung damage that we are worried about like we had in the Delta wave. So please, yes, I would encourage in pre-COVID times, we used to encourage for every child to take an annual flu shot up to 5 years of age. And now we push that age limit to 8 years of age, considering the COVID time. So please take your annual flu shot if your child is less than 8 years of age.
Fair enough. And absolutely the last question, any x-rays or any, tests to be done?
No saturation monitoring in your children. No x-rays unless until your pediatrician suspects a secondary bacterial pneumonia or a viral pneumonia, which is the opportunistic infection, or a persistent cough lasting for more than 7 days, and 100% no CT scans.
There you go. And yes, Bhavna, Doc is saying you should give the flu shots to the children. I have so many questions, but I'm sorry, and I apologize to everybody. We will not be able to take these, at least not this time. Maybe I'll get the doc again when he's free. Doc, before I let you go, one last word to all the parents listening in. What would you tell them?
I think, guys, like I said, let's start living with the virus. You know, a simple comparison. We've lived for so many years with the flu virus that has never asked us to hamper our lifestyles. It's getting there. I'm not downplaying the Omicron. It's an exaggerated form of the flu virus. It's going to keep getting better. Keep your guard on, keep your mask on, follow social norms recommended by schools and public places and your local governments. But please do not restrict your lifestyle. Do not restrict your lifestyle, your children's lifestyle. Send them to school, send them to classes as recommended. Let them start growing now. Let them start living the life that we promised them.
It's about time. I agree with you. And I think children going to school allows us to live a little bit of our lives as well. But thank you so much, Dr. Parekh, for taking the time out today. It was a pleasure to just listen to all your very, very substantive information and very to the point. And I don't think there's any scope for any further confusion, everybody. And I'll be in touch again, Doc. Hopefully, we'll have moved away from this topic and speak about better things in the future. But thank you so much for joining me today. Thank you.
Thank you so much. The pleasure is all mine. Thank you so much.
Thank you. And
Bye-bye.
thank you. Bye. Thank you.